Hello viewers, how are you doing? This is Friedman Praise Melody. Today we are going to be talking about high blood pressure. We have talked about low blood pressure in the previous video. So if you want to know about it, you can go back to our previous video to watch that. Today we are going to be talking about hypertension. So it will be very great you like and subscribe to this channel. Watch this very video to the end to get every bit of this information because it will help you very much. High blood pressure is a common condition that affects the body artery. It is also called hypertension, as we all know. If you have high blood pressure, that means the force of the blood pushing against the artery wall is constantly too high. The heart has to work harder to pump blood. Blood pressure is measured in millimeters of mercury. In general, hypertension is a blood pressure reading of 130/80 millimeters of mercury or above. High blood pressure has no specific symptom and can be dangerous if untreated. Hypertension puts you at the risk of stroke, heart attack, and other health problems. Nearly half of adults who have this condition rarely know they have them. So it is necessary you go for medical checkup and change your diet if you know you have hypertension. Go for regular exercise and make sure you are on medication. This will help keep the blood pressure where it should be. High blood pressure is classified either to primary hypertension or secondary hypertension. About 90 to 95% of hypertension, the cases are primary. This means they are of non-specific lifestyle and genetic factor. Some lifestyle that increase the risk of high blood pressure include excessive intake of salt, excess body weight, smoking, physical inactivity, and alcohol consumption. The remaining 5 to 10% of cases are categorized as secondary high blood pressure. These are of identifiable causes such as chronic kidney disease, narrowing of the kidney arteries, and endocrine disorder, even the use of birth control pills. How can you know you have this blood pressure? You can only know by going to the hospital or going to a healthcare provider and get yourself checked. And sometimes when you go to the hospital for other cases itself, your health provider can just do some tests for you and say, let me check your blood pressure, and by that you know, hey, do you know you have high blood pressure before? You say, no, I don't know. Oh, you have high blood pressure. This is what you should do. This is what you should leave. When you go to the hospital for regular checkup, you get all those things checked out. Signs and symptoms of blood pressure or hypertension. Hypertension is rarely accompanied by symptoms, and its identification is usually through health screening, as we have said. When you go for health screening or when you go for checkup, that is where you normally know, because the symptoms are sometimes hard to find or how to know for a layman. Some people have a headache. They report to the hospital with headache, most especially at the back of the head, and this occur in the morning, as well as lightheadedness, vertigo, tinnitus, that is buzzing or hissing sound in the ear, or third vision or episode of fainting. This symptom, however, may not just be for hypertension. It can be related to anxiety or other medical condition. The American College of Cardiology and the American Heart Association divide blood pressure into 4 general categories. The first one is normal blood pressure. This range from 120/80 and or lower. The elevated blood pressure, which is the second, the top number, which is the systolic, is 120 to 129 millimeters of mercury, and the bottom number, which is the diastolic, is not above 80. The third one, which is the stage 1 hypertension, the top number, which is the systolic, is 130 to 139 millimeters of mercury, and the bottom number, which is the diastolic, is between 80 to 89 millimeters of mercury. The fourth one, which is the stage 2 hypertension, the top number, which is the systolic, is 140 or above, and the diastolic, which is the bottom number, is 90 or higher. Blood pressure higher than 180 over 120 millimeter of mercury is considered to be hypertensive emergency or crisis. For such cases, you need medical attention immediately. Complication of high blood pressure if untreated. It can lead to heart attack or stroke. It can lead to heart failure. It can lead to kidney problems, eye problems, metabolic syndrome, change in memory or understanding. You can't grab something so fast or understand something so easily. Dementia. All these are complications of high blood pressure. What way can you prevent high blood pressure? You can prevent high blood pressure by following a healthy eating plan. You should know what you should eat per time, know what you should remove from your diet, what you should add to your diet. Cut down on sodium diets. Take less of sodium to prevent hypertension. Don't take too much of sodium. Keep active, like be doing activity like walking. Don't just keep yourself to idle. Go for exercise, walk up, jogging. All those things will reduce your risk of hypertension. Drink less of alcohol too, or if you cannot just leave alcohol, drink in moderation. Don't drink too much of it. It will reduce your risk of hypertension. Medication that can lower the blood pressure. If when you are diagnosed or when it is being seen in you that you have hypertension, there are some classes of drug. I'm going to mention 4 classes of drug here. They are first line treatment that can be given to you if you have hypertension. One of it is the angiotensin converting enzyme inhibitor, angiotensin 2 receptor blocker, calcium channel blocker, and diuretics. Those 4 classes of drugs, when you go to your healthcare provider and you have been diagnosed you have this condition called hypertension, they can administer any of those drugs to you, or if it is what involve lifestyle changing, they will tell you what to do and how you should go about it. So it is necessary you get yourself checked up in a hospital or with a healthcare provider. If you find this video very interesting, it would be very nice to subscribe to this channel, like this very video, share it to friends, and touch the notification bell so that when we post our other videos, you'll be one of the first person to get them.